சொல்லுங்களேன் அந்த எக்ஸ்பீரியன்ஸ். நீங்க தங்க பல்லு யாருக்கோ வச்சு கொடுத்தீங்க, அந்த எக்ஸ்பீரியன்ஸ் சொல்லுங்க.
எங்க அம்மாக்கும் வச்சிருக்கேன். அவன் அதை பத்தி சொல்லிட்டு
ஃபேமஸான ஒருத்தருக்கு வச்சீங்கல்ல, சொல்லுங்க.
ஸோ விஜய் சேதுபதி only. So
for Vikram movie. இவர்தான் அந்த தங்க பல்லு வச்சவர்.
very nice person as such. So before going, obviously I told them, say I don't want to go and sit there and wait for a long time. போனோடனே கொஞ்சம் பார்க்குற மாதிரி வச்சுருங்கன்னு சொல்லிட்டு. ஸோ ஐ திங்க் ஐ மெட் ஹிம் டியூரிங் தட் செட்ஸ் ஆஃப் தட் காத்து வாக்கில் 2 காதெல்லாம் அந்த படத்தோட இதில் தான்.
ஓகே.
ஸோ அதில் ஒரு 200 people are there in the set and they are doing a shoot. So once I went, within 5 minutes he called me.
Okay.
So genuinely he's coming and introducing himself. Hi, I'm Vijay Sethupathi. Sir, உங்களெல்லாம் தெரியும்.
Right.
Then we went and we, 2-3 times we met.
Okay.
He's like, sir, whatever is required, I'll give full cooperation. நீ என்ன பண்ணணும்னு சொல்லுங்க, அது எல்லாமே பண்றேன். சார் ஒன்றும் இல்லை, மெஷர்மெண்ட் தான் எடுக்க போறேன் அப்படின்னு சொல்லிட்டு. Even during pregnancy,
okay,
you can chew gum, but keep in mind whatever gum you're using, it has to be sugar free. Number 1.
Coffee, because I drink a lot of coffee, especially black coffee. So does that stain teeth a lot?
Yeah, so what we have to understand with coffee is, yes, it has staining agents.
Yes.
அதாவது oral health, particularly poor gum health. So what happens basically is, the gum health poor-ஆ இருக்கும்போது oral bacteria, that is bacteria from the plaque, hygiene maintain பண்ணாதனால accumulate ஆகிற bacteria, they get into the bloodstream through the gums, because now we have sufficient data to show that pregnancy can get affected before pregnancy. If you're doing IVF treatment, that can get affected. The chances for pregnancy itself.
Yeah, we should talk about that also. Okay. Hi, hello, vanakkam guys. இன்னைக்கு Smart Talks with Smart Ovaries la we have someone who I know from college time. சொல்லுவாங்கல்ல, that is oral health is giving clues for overall well-being. இவர் வந்து not only he repairs teeth, but also he gives confidence to everybody by repairing their smile. So welcoming Jibran from Truly Dental, founder of Truly Dental. Yes. எப்படி இருக்கீங்க smile architect?
Going good.
Going good.
Yeah.
It's been so long.
Yeah.
இல்ல எவ்வளவு வருஷம்னா சொல்ல வேண்டாம்.
Almost 2 decades.
இல்ல நான் பதிவு பண்றேன். I'm like 5 years junior to Jibran. Sorry. Okay, how is it going?
It's going good. I like the new feel of the clinic. First I used to be with a company, now I've started my own clinic. So it's good. More independence,
yes,
do what you want, at what time you want.
Yes. Amala, you can be your own boss. I did see அந்த உங்களுடைய கிளினிக்கோட அந்த infrastructure, and you created one concept. உள்ள அவங்க உட்காந்துட்டு இருக்கும்போது அவங்க பீச்சில் இருக்கணும்னா அந்த ஃபீலிங் கொடுக்குறீங்க, அப்படிலாம் காமிச்சிருந்தீங்கன்னா வேர் இஸ் ஆல் தட் இன்ஸ்பிரேஷன் ஃப்ரம்? ரொம்ப டிஃப்ரெண்ட்டாக இருந்தது. அது என்னது, அது LED மாதிரியா? How is it?
Yeah, it's background stretch ceiling or a new concept.
Okay.
So they have a LED box behind.
Okay.
And then you have a very high definition rubberized material in which they print a HD photograph. So that's stretched over there with a heat gun, and then they tuck it in, so you get a very clear picture.
Okay.
And we tried LED screens, but the screen is very harsh on the eyes. For a long time you cannot see the screens.
Seri.
So idu vandu very pleasant. You should come one day. Come see how it is.
கண்டிப்பா வரேன்.
So we have a corresponding.
So என்னலாம் போடுவீங்க அதுல?
Right now only one picture will be there in one room. So one is a beach concept, and the other one is a a nature concept for a river and this thing. Accordingly on the room la vandu the sounds also will be corresponding. Anga vandu waves odite irukum, இன்னொரு room la vandu birds chirping, water flowing.
Okay.
So you get a feel that you're not in a dental clinic.
I did recently show my daughter one of your videos where you said காமிச்சிருந்தீங்க Taylor Swift oda song போட்டு made her feel better. I showed that to my daughter and then she was like, okay, now I'll think about going to a dentist அப்படினு சொல்லிட்டு இருந்தா. So nice, very innovative,
so
very
the
different.
Inspiration is basically from our practice experience, what our patients want. So most of them, they have a fear for dentistry. So the whole idea is to give them a more comfortable, pleasant at least the
Yeah.
look wise,
Yeah.
it should be a more welcoming and pleasant
Yeah.
experience for them, so
No,
that they
so
get
true.
comfortable.
எனக்குமே வந்து என்னதான் நம்ம டாக்டரா இருந்தாலும் மேஜர் சர்ஜரிஸ் பண்ணாலும் அந்த டென்டல் வரும்போது இட்
Definitely,
இஸ் ஸ்கேரி.
it's there for everyone.
It is scary.
It's there for everyone.
அது
Yeah.
whatever minor procedure, it's very scary. So I think that's very innovative. Super. Congrats on that.
Thank you so much.
சரி, ஸோ நம்ம வந்து இன்னைக்கு ஐ திங்க் அஃப்கோர்ஸ் we're going to be talking about dental health, oral health, mainly in women தானே நம்ம பேசலாம்னு சொல்லியிருந்தேன். பட் பிஃபோர் கோயிங் இன் டு விமன் நோ, ஐ ஜஸ்ட் வாண்டட் டு ஆஸ்க் யூ ஜென்ரலாக சில
Sure.
questions இல்லை எனக்கு தோணுனது தான். ஐ வாஸ் ஜஸ்ட் வாண்டிங் டு ஆஸ்க் யூ இந்த ஓரல் ஹெல்த் இருக்குல்ல, மென்னுக்கும் விமனுக்கும் டிஃபர் ஆகுமா?
Actually speaking, men and women, they are totally different in the sense of their hormonal changes. That is the main differentiating factor. So in the hormonal changes, when the fluctuations, women ku jaasti irukku. Due to which they are more susceptible to get all oral
issues, is
oral
it?
issues,
Oh.
particularly gum issues.
Okay.
Yeah.
Okay.
But this is the fact. But statistics, they show in another way. Men are more prone to gum disease than women. So my take is basically probably women are more caring about themselves and hygiene and everything, where men are more
Obviously.
not obvious, but I'm saying maybe the statistics is because of that. Habits also, they have lots of habits and all those things. Maybe.
Okay.
They don't care much probably. Yeah. So but women
Maybe.
are more susceptible.
Okay, that's the fact.
That's the fact.
Okay, so இப்போ I mean before we jump into the topics, I saw a video இன்னைக்கு காத்தால தான் பார்த்தேன் ஆக்சுவலா. என்னன்னா வந்து போட்டிருந்தீங்க சில்ட்ரனுக்கு வந்து மவுத் ப்ரீதிங் இருந்ததுன்னா மவுத் டேப் போடணும்னு போட்டிருந்தீங்க. தட் வாஸ் வெரி இன்ட்ரெஸ்டிங். அந்த மாதிரி ஒன்று இருக்குன்றதே ஐ டிட் நாட் நோ. ஸோ அது applicable to adults also?
Yes. So basically mouth taping is for habitual mouth breathers. So by habit, they don't have a problem with their nostrils, nose, nasal pathway, but they still tend to breathe with their mouth. Now, mouth taping helps a lot. So, on the mouth taping, even for adults, we can use. But any habit, when they are young, if you control it, it's much more easier.
ஸோ இது வந்து தூங்கும் போது மட்டும் இல்லை, ஜென்ரலாகவே மவுத் ப்ரீதிங் இஃப் தேர் லைக்
usually the during the night time when they breathe through the mouth. That is a long period of time, and during the night time the saliva production is much lesser, so it becomes a very dry environment for the bacteria to replicate and cause decays, gum disease and all these other problems.
Okay, and the bad odor also that happens because of that.
It's all because of the bacteria.
See, I know. Dentistry எனக்கும் தெரியும்.
So that's the reason we don't want people to breathe through their mouth and use their nostrils. And yes, of course you can use it for adults, but underlying problems, adenoids, tonsils, nasal pathway, அதெல்லாம் clear-ஆ இருந்துச்சுன்னா யூஸ் பண்ணலாம். Habitually they are using their mouth, then they have to use a mouth tape.
So இது mouth tape-னே வந்து விக்கிறாங்களா?
You can use normal micropore, not sellotape, micropore tapes. Yeah, so you know the micropore tapes, so it's a little softer, and then you can fold the tips so that
ரொம்ப பேசினாலும் டேப் பண்ணிடுங்க, மவுத் ப்ரீதிங் எதுவாலும் டேப் பண்ணிடுங்க. ஃபர்ஸ்ட் எனக்கு தான் டேப் பண்ணுவாங்க அப்படி சொன்னா. Okay, so that can be used for adults also. Okay, it's not risky or anything, because when I saw that picture, எனக்கு I was thinking குழந்தைங்களுக்கு இது பண்ணலாமா, சேஃபா? I was thinking.
So the main idea here is habitual. That's the key word. So if there's no underlying problem, like for example child is having a cold cough, okay, nostrils are fully blocked, will you mouth tape? You shouldn't.
That's risky, of course.
So that's the whole idea. So if the patient or if the child or the adult is doing it habitually, nostrils எல்லாம் clear-ஆ இருக்கு, நல்லா நோஸ்னால ப்ரீத் பண்ண முடியும், ஆனாலும் வந்து தூங்கும் போது தவறி வந்து வாய் ஓப்பன் ஆகி ஃப்ரீயா ப்ரீத் பண்றாங்க மவுத்னாலனா, then you can mouth tape.
Okay.
So we have to first make sure that there's no underlying cause. So that's why even in that video I told to check with an ENT specialist to make sure that they're not doing it because they don't have any a clear nasal path.
Right. Okay. Got it. So இப்போ வந்து for women, especially pregnant women, நிறைய பேருக்கு தெரியாது that oral health நால pregnancy there is a connection, and of course gum issues are more in pregnant women. Actually எனக்கு வந்து நிறைய பேர் pregnant women வராங்கல்ல, அவங்க என்ன சொல்லுவாங்க, ரொம்ப டூத் சென்சிட்டிவா இருக்குன்னு சொல்லுவாங்க. எஸ்பெஷலி செகண்ட் ட்ரைமிஸ்டர்ல இருந்து தான் சொல்றாங்க. அது இஸ் இட் காமன்?
Yes.
அப்படியா?
Yes, definitely.
அது எதனால, why does that happen?
So I'll tell you. So the main reason for sensitivity during pregnancy is two ன்னு சொல்லலாம். Yeah, ஒன்னு வந்து morning sickness. Okay, so morning sickness, you know, they feel nauseous, they vomit. Suddenly after they vomit, what they do, they want to feel fresh, they go brush their teeth. So that is a very acidic time. That is, once you vomit, there's lots of, you know, stomach acids which come out through the mouth, and it becomes very acidic. And the acidic nature la நம்ம brush பண்ணும்போது the enamel wears off.
Oh, so
then it causes
not to do
sensitivity.
that? Okay.
So what we have to do to avoid this is, once they, you know, if at all throw up,
Okay.
நல்லா mouth rinse பண்ணா போதும்.
With plain water?
Plain water. Up to 20 minutes. This mouth will be acidic.
Okay.
If at all they want to brush, they want to get that fresh taste, only after 20 minutes. So this will cause enamel erosion.
Okay.
Yeah, due to the morning sickness.
Okay.
Second thing is, when they are pregnant, as we already know, there's a lot of hormonal changes. And the hormonal changes nala, the mouth bacteria, the plaque which is there, no, the body's immune response is usually very less. You know, during these hormonal changes.
Yeah.
So the bacteria in the mouth, that is the plaque bacteria and so on, they attack the gums, which is the closest area. You know,
Okay.
tooth la vandu it takes a long time to react
affected.
and attack.
Okay.
So gums la vandu easy affect பண்ணி
Okay.
inflammation உண்டாக்கும்.
Okay.
So அந்த inflammationனால தான் இந்த gumsலாம் வந்து inflame ஆகி gingivitis வருது. So இந்த gingivitis வந்து அட்டெண்ட் பண்ணாம விட்டுட்டோம், ஒழுங்கா நம்ம oral hygiene maintain பண்ணலனா, it progresses further to the bone and gums, like the under the
So
tooth.
that what happens in pregnancy.
Yeah. So the gums weak ஆகும்போது என்ன ஆகும்னா, the tooth roots வந்து expose ஆயிடும். That will cause sensitivity. So even when your gums are not healthy, it shows as sensitivity.
Okay.
Because the roots
Suppose
are
அவங்களுக்கு morning sickness இல்ல, but still they say that their tooth is sensitive, then they only have to rinse it.
Yeah, if because of gums being weak, they can get sensitivity. If they have any decays, usually they have these cravings and sweet tooth during pregnancy. That can also lead to more of tooth cavities and you know, sensitivities occurring.
So okay, fine. So அந்த மாதிரி sensitivity வந்தா they shouldn't worry, but they should know that their gums are weak. So gum strengthen பண்றதுக்கு is there any ways?
So the first thing is, once you know you're pregnant, you have to step up your oral hygiene game. Okay,
it's not just about your belly, your baby llama, your oral health matters.
Oral health matters because the next 1.5 years is going to be a roller coaster ride for your hormones. And the first place it affects is in your gums. Okay, so the oral hygiene வந்து நம்ம better பண்றதுக்கு, you have to start using a water flosser, a physical floss, obviously the 2 times brushing, and more of mouth rinsing. Whenever you eat anything, rinse your mouth, spit it out, or even drink that water, but you have to keep your mouth as clean as possible so that that bacterial plaque build up on your teeth is controlled.
Okay.
அதை கண்ட்ரோல் பண்ணோம்னா கம் டிசீஸ் வந்து நம்ம அழகா கண்ட்ரோல் பண்ணிக்கலாம்.
இது ஐ திங்க் நார்மலாவே நான் பிரெக்னன்ட் இல்லனாலும் this applies இல்ல.
But usually வந்துட்டு everybody they take, you know, that 2 times brushing is okay. Now everybody has accepted it.
Yeah.
Nobody knows about the flossing.
Yeah.
See, unless we floss our teeth, 40% of our teeth is still unclean.
Okay.
So between the teeth, food accumulation will happen.
Okay.
And that has to be clean
So
only with the
everyday
physical
flossing.
Flossing or at least water flossing.
Okay.
The water flosser is much more easier. You know, you don't need to put a physical
I think ஒரு டூத் ப்ராப்ளம் வரும்போது தான் அது பண்ணாங்க. நானும் அந்த மாதிரி தான்.
Everybody is like that. அது வந்து அந்த டூத் பெயின் வந்தாதான் அது ஒரு ப்ராப்ளம்னே நினைப்பாங்க.
நம்ம ஆசைப்பட்டது சாப்பிட முடியலையே, எல்லாம் முழுங்கிட்டு இருக்கோமே, இது ஒரு லிக்விட் டயட் மாதிரி போகுதுன்னு. ஓகே, இந்த ரின்ஸ் பத்தி யூ டோல்ட்ல, அப்போ எனக்கு என்ன ஞாபகம்னா, யூ ஹேட் புட் அப் அ வீடியோ ஆன் திஸ் மவுத் வாஷஸ். உங்களால நான் மவுத் வாஷே நிறுத்திட்டேங்க வீட்ல. சீரியஸாவே. பட் தட் ரியலி லைக் ஐ வாஸ் லைக் ரியலி இஸ் திஸ் ட்ரூ அப்படின்னு நான் யோசிச்சேன் நான். ஏன்னா இது வரைக்கும் நான் அந்த மாதிரி பார்த்ததே கிடையாது. அண்ட் அதுல மைல்டு மவுத் வாஷ் இருக்கு, ஸ்ட்ராங் மவுத் வாஷ் இருக்கு. சில பேர், சில டென்டிஸ்ட் தே ஈவன் அட்வைஸ் டு டேக், தே ஈவன் பிரிஸ்கிரைப், ரைட்? ஸோ தட் இஸ் தட் ட்ரூ? அண்ட் ஐ மீன் யூ டெல் மீ அபவுட் இட்.
Yeah, so basically mouthwashes are what you get over the counter. Most of them have alcohol in it. So the alcohol dries the mouth, and usually these mouthwashes kill all the bacteria in the mouth, right? But we need the good bacteria. Yeah, and also these mouthwashes are meant to be diluted and used. Many of them they don't dilute directly, they put it in the mouth, and it is supposed to be used only for a
நீங்க சொல்ல சொல்ல என்ன பத்தி சொல்ற மாதிரி இருக்கு.
it's only for a particular period of time. Even if the dentist prescribes, it's up to a 2 weeks period to get their gums healthy, or get the sensitivity control.
Right.
It's not to be used in a long term, this thing. And
Okay.
it stains the teeth. And recent studies are coming up which shows that regular use of this over the counter mouthwashes
சொல்லாதீங்க. இல்ல
they
சொல்லுங்க.
can cause hypertension.
ஓ அப்படியா? Okay.
So அது
So I
வந்து
used to
it's
use
not fully
regularly.
proven, but yeah.
Like after meals I used to have, because in the bad odor இருக்கக்கூடாது, இல்ல especially non-veg சாப்பிட்டா. Seriously, I stopped after seeing a video. I wanted to tell you that. நான் சொல்லல இதுக்கு முன்னாடி. I was like, is this even true? Because everybody uses it left, right, center. இல்லையா? So mouthwashes over the counter are a big no.
Big no. And it is going to make your problems bigger. Like say you want to feel fresh, but some people actually have the bad breath, which comes because of a lot of bad bacteria in the mouth. That is because of your gum disease. Your gums, your hygiene is not so well. So they start using the mouthwash. So once they use the mouthwash, the next 15-20 minutes they're going to feel fresh.
Oh.
Okay, but again it's going to just progress the gum disease and make it more.
Okay.
So it's definitely a no.
You know what, இது எப்படி தெரியுமா இருக்கு, like people who come vaginal ஏரியாவை clean வைக்கிறதுக்கு they buy these over the counter vaginal washes.
Yes.
And the natural bacteria that's there in the vagina goes off, so they're exposed to more of vaginal infections. So we tell them don't buy it.
Correct.
அதுதான், I mean,
Same thing.
I just thought of that. Okay. So இப்போ in the gingivitis during pregnancy because of hormonal changes, you said la. So during puberty also, of course, there is hormonal changes. During menopause also there is hormonal changes. So appo in the gingivitis வந்து இப்படிதானா, it is going to affect them more?
Yes. So what happens is anytime during these hormonal changes, be it puberty, menstruation, pregnancy, or menopause, there's going to be some oral changes that's going to happen. Puberty time la most common is your gingivitis. The same thing when during pregnancy
also.
Also sensitive teeth, decays increasing and all this. During menopause, it's a little more advanced because the people are a little elder, So that time what happens, the gingivitis reaches up to the bone, and more commonly we see patients coming in with spacing between the teeth.
ஓ அப்படியா?
இவ்வளோ நாளா என் பல்லு நல்லா இருந்தது, பட் இப்போ வந்துட்டு lots of gaps between the teeth, front teeth, back teeth, and that's because your gum and bones are weak and it was not attended to.
Okay.
Moreover, during menopause, dry mouth happens. So it gets very dry, and these bad bacteria, they replicate much faster. So the gingivitis la irundhu it reaches to the bone and becomes periodontitis.
Okay. So menopause la in the dry skin, dry vagina, dry scalp mari, dry mouth.
Yeah, dry mouth brings in a lot of other problems. High sensitivity, gaps between the teeth, decays which are there in a small stage, aggravates and progresses
during
much faster.
menopause. Okay. So after 40 or 45 perimenopausal period la, should they change their oral habits or whatever you said before?
So
same
as I told you, women throughout their whole lifespan, they have to take care of their oral health in a much more a better way.
Okay,
so not only brushing 2 times. So the first thing is visiting your dentist,
right?
Because everybody feels there's nothing wrong with their teeth.
Go only when it is needed.
There is a problem, when there is a this thing. So definitely meet a dentist, find out if something is wrong, and how to maintain and prevent that plaque accumulation. So that is the key source of the problem which you can get. Adha நம்ம கண்ட்ரோல் பண்ணிட்டோம்னா மத்த எல்லாமே ஈஸியா இருக்கும்.
ஆயிடும். ஓகே. இன்னைக்கு எல்லாரும் வந்து நைட் பிரஷ் பண்றீங்க. சும்மா. ஓகே. ஸோ இப்போ வந்து டென்டல் ப்ரொசீஜர்ஸ்ல of course pregnant வரும்போது first 3 months we ask them, did you do any dental procedure, because we want to know if they're exposed to any x-ray radiation. But if they have to go through any dental procedures, what is to be avoided and what can be done?
So I think right from when we were starting to practice until recently, we all knew that dental x-rays are a big no during pregnancy, right? And
Yes.
you
Yeah,
still
even
think,
I am scared.
Yeah.
Yeah.
So now the American Dental Association, along with the American Association for Obstetrics and Gynecology, they've come up and said dental X-rays are absolutely safe throughout the period of pregnancy,
Oh.
provided you take a proper
Shield, huh?
shield.
Abdominal shield.
Not only abdominal, the overall thyroid
The
shield is
full
there.
shield.
Lead aprons.
Okay.
So
Okay.
your dental procedures can be done, but we try to keep the procedures only for pain management and something which is absolutely required.
Okay.
If it
Okay.
is an aesthetic procedure, anything elective, we
Not
postpone
needed. Not
after the
needed.
pregnancy.
Okay.
So yes,
Okay.
dental procedures are very safe to be done if
Okay.
it is done properly.
Okay.
By the
மேக்ஸிமம் காமனா என்ன கேட்பாங்கன்னா ரூட் கனால் பண்ணலாமா இதான்
because it's
கேட்பாங்க
a
பேஷண்ட்ஸ்
pain thing, so when the patient comes
they
in with
have
the
to
pain,
do it ன்ற ஒரு சிச்சுவேஷன் பண்ணலாம்.
definitely பண்ணலாம்.
எந்த ட்ரைமஸ்டர் வேணா பண்ணலாமா?
Safest is second trimester.
Okay.
So during pregnancy, safest is
Second
second
trimester is the honeymoon period, no? Where we say you can travel, you can have sexual contact, and then procedures.
Procedures, most
Okay.
safest.
Fine.
Yeah.
So root canal சொல்லுவாங்க. One more thing is pulling out tooth.
Tooth. See, the whole idea here
Everything
is
can
pain
be done.
management.
Okay.
Because they're already in so much of pain.
பிரெக்னன்சில வந்து எனக்கு தங்க பல்லு வைங்க, டைமண்ட் வைங்க,
வச்சுதான் கொடுக்கணும்.
கிளம்புங்க அப்படி. Okay, fine. So that is there. So during periods,
Yeah.
does that make a difference
So
for
see,
dental
the whole
procedure?
idea here is during that time, the whole body's healing capacity is a little reduced. And the blood flow is going to be continuously taking place, so the body secretes certain enzymes for that. So when you do a tooth extraction, even that is going to have a very delayed delayed healing.
If you
More
do it
bleeding.
during the
Yes.
period time.
So
Okay.
that's why we avoid after the because that is something just
So
1
post
week or 2
menstrual
weeks,
is fine.
we can
Okay.
we can proceed
Okay.
with this.
Fine. Good. This is all like new to me. நானே என் பேஷண்ட்ஸ்க்கு இனிமேல் இப்படி சொல்லுவேன். ரைட். நடுவில் ஏதோ தங்கப்பல்லுன்னு நான் சொன்னேன்ல. எனக்கு அது சொல்லுங்களேன் அந்த எக்ஸ்பீரியன்ஸ். நீங்க தங்கப்பல்லு யாருக்கோ வச்சு கொடுத்தீங்க. அந்த எக்ஸ்பீரியன்ஸ் சொல்லுங்க.
எங்க அம்மாக்கும் வச்சிருக்கேன். அவன் அதை பத்தி சொல்லிட்டு
ஃபேமஸான ஒருத்தருக்கு வச்சீங்கல்ல. சொல்லுங்க.
So Vijay Sethupathi only. So
For the Vikram movie.
So
இவர்தான் அந்த தங்கப்பல்லு வச்சவர்.
very nice person as such. So before going, obviously I told them, I don't want to go and sit there and wait for a long time. போனோடனே கொஞ்சம் பார்க்குற மாதிரி வச்சிருங்கன்னு சொல்லிட்டு. ஸோ ஐ திங்க் ஐ மெட் ஹிம் டியூரிங் தட் செட்ஸ் ஆஃப் தட் காத்து வாக்கில் 2 காதெல்லாம் அந்த படத்தோட இதில் தான்.
Okay.
ஸோ அதில் ஒரு 200 people are there in the set and they are doing a shoot. So once I went, within 5 minutes he called me.
Okay.
He's so genuine, he's coming and introducing himself. Hi, I'm Vijay Sethupathi. Sir, உங்களெல்லாம் தெரியும்.
Right.
Then we went and we 2-3 times we met.
Okay.
He's like, sir, whatever is required, I'll give full cooperation. நீங்க என்ன பண்ணணும்னு சொல்லுங்க, அது எல்லாமே பண்றேன். சார் ஒன்னும் இல்லை, மெஷர்மெண்ட் தான் எடுக்க போறேன் அப்படின்னு சொல்லிட்டு we did it. And during the fitting also he was very comfortable.
So இதுக்கு வந்து anesthesia எதுவுமே கிடையாது.
Nothing. See, for him, so it was only
சரி, எப்ப வேணா போடலாம், எப்ப வேணா கட்டலாமா, இல்ல நீங்க தான் வந்து போட்டு கட்டலாமா?
He can remove it. We made 2 sets for him. So first set வந்து we didn't know that he had to bite and and the scenes you've seen, the kadiche apdi mari idu பண்ணுவாங்க. That and all we didn't know.
Not, is it?
No, obviously this is something which is just kept on top of the teeth, no?
Right.
So he broke it.
Oh,
so
okay.
the first set. So the second set I made was a little more thicker.
Okay.
And went on top of it. That was very, hard to break. So அந்த மாதிரி. So fix பண்ணும்போதும் வந்துட்டு he gets into that character. Once I tried it on, he's biting and seeing in the mirror. Correct இருக்குமா? That time I didn't know.
Okay.
What's he doing in front of the mirror? He's biting his teeth and all யோசிச்சுட்டு இருந்தேன். அப்புறம் படம் பார்க்கும்போது தான் தெரியும்.
Huge difference. I think நம்ம நடுவுல ஒரு small water break எடுக்கும்போது நம்ம டீம்ல இருந்தே they asked you a question, no? I think we should definitely record this. So chewing gum regularly, does that affect the gums or the tooth?
Yeah, so chewing gum is actually good for our teeth and oral health. What it does is it cleans away the teeth and it promotes saliva production. Saliva is good for your teeth. It's good for your gums. Everything. The only thing is you have to do it in control. Yeah, so don't chew gum for more than 15 to 20 minutes at a time.
அவ்வளவுதான்
15 to 20 minutes. It loses its that
taste and it goes off. It becomes, I think
more
now it's like a style
also.
statement to put on the gum, has a cool effect, but it does have its side effects.
Yes, if you overuse anything, it's not good for you. So you keep chewing gum and then it can, tire your muscles,
Right.
joints,
Right,
teeth
right.
can wear off. All those things can happen.
Okay.
But if you do it in limitation, it's actually good for your teeth.
Okay. Okay.
That's the thing. Even during pregnancy,
Okay.
you can, chew gum. But keep in mind, whatever gum you're using, it has to be sugar-free, number one. Yeah. Second thing is, if it has xylitol, it is having even more better, effects on the teeth. Xylitol is like a superfood.
Okay.
It helps in regenerating the
Okay.
enamel.
Okay.
And makes it much
All
more
those
better.
flavored gums, adella sugar.
Probably. Just check for sugar-free xylitol,
Yeah.
that's all. When
Okay.
you get gum.
ஓகேங்களா நோட் பண்ணிக்கிட்டீங்களா நோட் பேட்ல இது ஆக்சுவலாக இந்த கம் பற்றி கேட்கும்போது ஐ ஹாவ் அ டவுட்
Yeah.
டூத் பேஸ்ட் இருக்குல்ல there's so many types of toothpaste gum protection ku toothpaste fluoridized non fluoridized I mean is there any criteria like this to look for illa flavor is there and இப்போலாம் நிறைய flavors வருது colorsல வருது so how do we choose this toothpaste
Okay, so the basic ABCD is the toothpaste is like how you said, there are different varieties which attend to different problems in the mouth. Like gums ku vandu thaniya, enamel ku thaniya, tooth decay ku thaniya, fresh breath, for the, saliva production jaasti ஆறதுக்குலாம்
And
நிறைய
whitening
toothpaste
க்கு கூடலாம் toothpaste
whitening
இருக்கு.
toothpaste இருக்கு. See, the you have all the options in front of you, but the only thing is you don't know what is required for you.
right
So how will you know that is, you have to consult with a person who knows more about teeth.
correct
That is a dentist. So
Yes.
only if you visit a dentist, get your teeth checked,
Yes.
we can actually
Tell you
find out
what type
what
of-
is required
Okay.
for you.
okay
Otherwise, you have to use some common toothpaste. Usually, we recommend a white toothpaste. Don't use any gels. Yeah, and because the gels have more abrasive. Even the whitening toothpaste
Right.
are having more abrasive
it doesn't
agents.
whiten
And it gives a temporary feeling of whitening because it has, the abrasive agents.
Okay.
So,
Oh, okay.
But it causes more of enamel damage in the long run.
okay
So even if we prescribe a whitening toothpaste, it should be usually for a very short period of time.
Okay.
And it is to follow up with the bleaching or something which we do, so that it gives that temporary, appearance of white teeth.
Okay.
But in general, only if you get your teeth checked,
Then only
you
you'll
know what is actually required for you.
Okay. So இந்த whitening பத்தி பேசிட்டு இருந்தோம்ல ஜிப்ரான் so அந்த whitening பத்தி பேசும்போது I'm just like thinking coffee because I drink a lot of coffee especially black coffee so does that stain teeth a lot
Yeah, so what we have to understand with coffee is, yes, it has staining agents that's called as tannins and solita. But these tannins are actually more in tea. And in green tea, it's the maximum.
Oh.
The staining agents.
Okay.
But with coffee, what the problem is, it's very acidic.
okay
So when you're having coffee, if you're going to have it in 5 minutes, it's okay. But you sip on coffee for a long period of time,
Yeah.
it creates an acidic nature in the mouth.
yeah
So in the acidic environment, what it does to the enamel is, it makes your enamel a little rough. The enamel which is supposed to be highly polished and glossy and strong, because of this repeated acid attack, is going to be a little eroded. So when it's
Oh.
eroded, these
Staining, it becomes more.
obvious
Oh.
and it gets more
பட்
troublesome.
ஆனாலும் அந்த காஃபியை வந்து மெதுவா காத்தால அந்த மார்னிங் காஃபி சிப் பண்ணி அது 5 மினிட்ஸ்ல குடிக்க முடியாது
Okay,
ஜிப்ரான்.
15 minutes பண்ணிக்கோங்க. But only tip that I will give you if it is, if you regularly have coffee is
Yeah.
right after finishing your coffee, rinse your mouth with
Okay.
water. To bring back your, oral environment to a neutral pH. Otherwise, it stays acidic. Rinse with
I
water.
think a huge takeaway from this entire conversation normal mouth rinsing இது போறோம்
Just
இது
with
வந்து
water.
ரிப்பீட்டடா பண்ணுங்க
Yeah.
ரைட் ஓகே ஸோ கம்மிங் பேக் டு women health and all I don't know how many people know this that oral healthக்கும் preterm birth that is கொரப்பிரசவம் the chances are higher for those who have right almost 15 to 20% higher chances of preterm birth and preterm labor la போறதுக்கு chance இருக்கு because of oral issues அது tell me about that
Okay, so basically we have a lot of data, a lot of studies which corresponds to this.
Yes.
அதாவது oral health, particularly poor gum health. So what happens basically is, the gum health poor-ஆ இருக்கும்போது oral bacteria, that is bacteria from the plaque, hygiene maintain பண்ணாதனால accumulate ஆகிற bacteria, they get into the bloodstream through the gums and through the bone. From the bloodstream, they can reach anywhere in the body, and during pregnancy, it can go to your amnion. amniotic sac.
Okay.
So once it reaches there, the body's response is to create more prostaglandins, amniotic prostaglandins.
Okay,
Because of the amniotic prostaglandins,
They
it
get
can
into
rupture and
labor.
the sac ruptures and goes for
Okay,
labor.
okay.
So what we have to understand is this oral bacteria can reach anywhere in the body, including the brain, the heart, the joints, skin issues. Yeah, all these can happen because of poor oral hygiene.
Okay.
And in terms of pregnancy and this thing, it's been there out in the
Yes,
for a
yes,
long time.
yes.
So my question to you, Sharanya,
Yeah.
when you know this, why are you not referring your patients to a dentist to get a oral health? Because this is something which I ask Surakshit also all the
Yeah.
time. See, because now we have sufficient data to show that pregnancy can get affected before pregnancy. The if you're doing IVF treatment, that can get affected. The chances for pregnancy itself.
Yeah, we should talk about that
Yeah.
also. Okay.
So definitely
Yes,
gets
yes.
affected.
No, இது வந்து நீங்க சொன்னது எனக்கே இட்ஸ் a learning curve. And ஃப்ரம் தட் முதல்ல இருந்தே இருக்கு இந்த டேட்டா. இன்ஃபேக்ட் நான் பிஜி பண்ணும்போது மை பெஸ்ட் ஃப்ரெண்ட் வாஸ் டூயிங் அ ஸ்டடி
Yeah.
ஆன் ப்ரீடேர்ம் லேபர் பேஷண்ட்ஸ் யாரெல்லாம் வராங்களோ அவங்களுக்கு வந்து ஓரல் இஷ்யூஸ் இருக்கா அப்படின்னு. ஸோ ஷி டிட் அ ஸ்டடி ஆன் தட் ஆல்சோ. ஸோ வி ஆல் நோ திஸ் கரெக்ட். பட் I think, as you said, regular patient ulla varumbodhu, I mean, yesterday we had a talk with a psychiatrist and I was telling her, I think one counseling session regularly should be there, either antepartum, postpartum, to prevent postpartum blues. And the mari, I think, or a dental, even if they refuse to go to the dentist, I should be
second
like, what's happening to your oral health?
Second trimester, you tell them it's compulsory to get your teeth cleaned.
Yes, yes.
Because otherwise it aggravates in the next stages.
நான் இனிமேல் எல்லாம் வந்து ட்ரூலி டென்டல் அனுப்புறேன்.
Not necessary.
பதிவு பண்ணிட்டேன்.
Wherever it's for their own good.
Okay, so you said நடுல fertility பத்தி.
Yes.
So of course I deal with a lot of fertility couples, right, who come for fertility treatment. So for men, அவங்களுடைய sperm count and quality does have a connection with their oral health.
Correct.
And for women also, their fertility issues and oral health as a connection. Just throw us some light on that.
So basically, what I would say is the gum disease is the main factor.
Culprit.
So the main culprit is gum disease. Through the gum disease, that is the bacteria are entering into the bloodstream, and it can go anywhere in the body, as we already discussed. For women, it goes to the uterus. Yeah, so it causes bacteremia of the uterus. So there's an acidic environment in the uterus.
Okay.
So they won't get conceived. The chances for them to get conceived is less. Yeah.
Oh, you mean like it affects that uterine environment,
Yes.
the quality of all those receptors
Yes.
gets affected. Okay.
So the chances for them to conceive itself is less. So if a person is coming for your IVF treatment, the first place they should go is to check their gums, make sure that their gums are healthy, then only start with the IVF treatment. Yeah, so that gets a much more success rate. For women, not only,
Men.
For men, not only your sperm count and the virility,
Motility and all that.
motility, it's also erectile dysfunction.
Okay.
So men with gum disease have proven to have erectile dysfunction.
Okay.
So good oral health leads to good reproductive system.
Right.
So
this is some great insight what you have said.
So this again.
Okay.
So whenever we have an IVF patient,
Right.
I would request you to first get their gums checked and then proceed with any treatment.
Okay. சரி, இப்போ வந்து நம்ம வந்து ஒரு ரேபிட் ஃபயர் ரவுண்ட் போகிறோம். அதுக்கு நான் வந்து கிரிஞ்சா இருந்தாலும் ஒரு பேர் வச்சிருக்கேன், ஸ்மார்ட் ஷார்ட்ஸ். ஓகே, ஸோ லெட்ஸ் டூ தட். ஸோ திஸ் ஆர் தட் யூ ஹேவ் டு சூஸ். Floss before or after brushing?
Floss before. Because, can I tell?
Yes, please.
So basically, when you floss, the dirt between your teeth comes out. And then you brush it off.
So that
Very
gets
simple.
washed off.
Yes.
Okay.
Floss before.
Okay. Morning sickness or sugary cravings, which is worse for teeth?
Both are bad, but sugary cravings is something which you can control. Morning sickness you cannot control. So yeah, sugary cravings, I think.
Actually, next question, you already told the answer. Mouthwash or no mouthwash?
Yeah,
yes,
no
we know
mouthwash
the
any day.
answer. Yeah. Okay, whitening toothpaste during pregnancy, safe to use or skip it?
Skip it.
இது வந்து electric toothbrush or regular or finger or வேப்பங்குச்சி?
Manual toothbrush any day better.
Okay.
But actually, electric toothbrushes are extra help for the patient to maintain the oral hygiene. But the whole misconception is once they start using an electric toothbrush, they feel more fresh because of the vibration it causes.
Okay.
So it's like a vacuum cleaner. Okay, it's going to definitely do a better job than sweeping. But you have to use the vacuum cleaner correctly. Yeah, you have to take it to the places, the right direction for it to work effectively. Same way, the electric toothbrush is a very good system.
You have to
But
know how to
you have to
use
know
it.
how to use it.
There are so many electric toothbrushes.
Yeah.
And I think எல்லாமே different இல்லையா?
Correct.
So electric toothbrush, visit your dentist, ask them what type of electric
Yeah.
toothbrush to use.
Yeah.
Okay. And normal manually there are so many types
So
இல்லையா,
many
Jibran?
varieties, yeah.
So சிலதெல்லாம் ரொம்ப harsh-ஆ இருக்கு,
Yes.
சிலருக்கு soft bristles இருக்கு.
Yes.
Which one would you recommend?
Ultra soft. See, the whole idea here is
okay.
your toothbrush is actually, the name is wrong. It's not only a toothbrush, it's a brush for your tooth and your gums.
See?
So
எனக்கு இந்த பாட்காஸ்ட்க்கு அப்புறம் நான் gums பத்தி சொல்லலனா
it's more,
I didn't listen to you. Okay.
Yeah. So basically, the toothbrush has to be kept partially on your gums, partially on your teeth, and clean off the.
So நம்ம brush பண்ணும்போது teeth மட்டும் தேக்காம, you're saying the bristles have to touch the gums also.
Correct.
Oh, it's not going to
shouldn't,
harm it.
Yeah, your brush shouldn't harm your gums. So when your gums are weak, it'll start bleeding, redness, and everything.
Correct.
If your gums
yeah,
are healthy,
sometimes when we brush, little bit of bleeding comes, right?
Yes.
That's because of the gums.
Gums. So that when the gums are weak, they easily get disturbed and they start bleeding. That means there's a inflammation going on over there.
Okay.
That means that area actually requires more attention than the rest of your mouth. But conveniently, what we do, on the area brush pochuna blood varudhu solli, they avoid brushing.
We avoid. Correct.
That will actually cause the problem to increase.
Oh. Yeah. Okay.
So bleeding during brushing is not normal. That is
the
something.
Finger.
Yeah, see, you can use, if everything is a tool, if you should use it effectively. Finger definitely no, because it won't reach properly on your this thing.
Okay.
The kuchi has to be very soft if you want to use it. Make sure you use it correctly.
யாரெல்லாம் பாங்க குச்சி யூஸ் பண்றீங்க? யாரும் இல்லையா? Okay, myth or fact?
Yeah.
It's normal to lose a tooth during pregnancy.
No, it's not at all normal. It's a
myth. Morning sickness doesn't affect your teeth. Of course, you had already mentioned about this. Pregnancy can make gums more prone to bleeding during brushing.
Correct. Yes, that's
because
of the
gingivitis. Okay, so they should not worry. They should just focus on
oral hygiene. Better. Yeah.
Okay. Brushing twice a day is enough. இது அடிச்சிருவீங்க இது சொன்னா. இவ்ளோ பேசியா நீ இத கேக்குறியா நீ அப்படின்னு. Brushing twice a day is enough even if you don't floss.
No. You have
because
to floss.
நிறைய பேர் they don't floss. Like flossing is like, honestly நான் சில Instagram reelsலாம் பார்த்திருக்கேன். Flossing will damage your tooth அப்படின்னு சொல்லிட்டு நிறைய I've seen reels. Have you seen those? So they'll be like, don't floss. And then சிலதெல்லாம் looks very sharp and looks different. So அது எப்படி?
See, again, same like choosing your toothpaste. Whether you need to floss, you definitely need to floss, but the intensity of how much you floss, what type of a floss you use, because there's so many different types of flosses itself. So அது ஒரு toothக்கு தகுந்த மாதிரி there's floss, there's interdental brush and everything. Again, the person who knows better will be your dentist.
Yes.
You have to get it checked.
Yes.
And there are sometimes certain areas you have to floss.
Right.
Certain areas is okay to floss only once a week.
Okay.
So it all depends on how healthy your mouth is.
Okay.
And depends on the spaces between your teeth, where and all it is there. And but definitely flossing is something which is universally accepted.
Okay.
But over here it's still
மக்கள் பண்ண ஆரம்பிக்கணும்.
கண்டிப்பா if you want to properly maintain hygiene.
So for those listening to this, if you don't know what flossing is, இல்ல flossing பண்றதுக்கு பயப்படுறீங்கன்னா visit your dentist.
Yeah. And for pregnant women, flossing might be a little difficult.
Okay.
So there's an alternative which won't do the 100% work of a floss, but it is going to help the women much more better during their pregnancy. Is a water flosser.
Okay.
You've heard of a water flosser?
Yes, I have.
A small equipment, you fill water inside it and then you switch it on. It cleans your gums in a much better way.
Okay.
So with the pregnancy, this is going to at least make it much more comfortable because the plaque is going to be reduced in the mouth.
Okay. Nice. Okay, would you rather treat pregnancy gingivitis or morning sickness induced enamel erosion?
Enamel erosion, because pregnancy gingivitis, there's a lot of role that the patient has to do. Even if I do a treatment for that, it can reoccur if they don't maintain well. But erosion is
Something that
irreversible
needs
process.
to be
Yeah,
attended
the
to.
enamel
Okay.
gets damaged, it stays that way.
Oh,
So
okay. So
better to-
அதுதான் better. Okay. இது உங்களுக்கு கேட்குறேன். Would you rather skip flossing for a week or eat sugary foods for one day?
eat sugary foods for one day.
எங்க
Already I'm
இருந்தாலும்
doing
அந்த
that.
ஃப்ளாஸை நான் வந்து விடவே மாட்டேன் அப்படின்னு. That's it. Rapid
Yeah.
fire round over. Smart shots round over.
Right.
Okay, so we've come to the end of this episode. I think எனக்கு மட்டும் இல்லை கேட்டுட்டு இருக்க ஆடியன்ஸ், for women especially who are planning to get pregnant, who are already pregnant, I think they've understood clearly that for women, because of hormonal changes, oral health is it is related to it. அதுக்கு நீங்க உங்க dentist visit பண்ணுங்க. You have to take care of your oral health. That is equally important. செம்ம இன்சைட் கொடுத்தீங்க எல்லாத்துக்குமே. எனக்குமே நிறைய விஷயம் தெரியல. நானும் நிறைய பர்சனல் கொஷின்ஸ் நடுவில் இந்த பாட்காஸ்ட் மூலமா I wanted to get out of you. And it was really, really insightful. I had a great time. I hope you also had fun.
Thank you so much. Yes.
Thank you. Thanks for joining in.
Thank you for having me.
Yes.
And my only request will be
Yeah.
to start referring
Sending
your
patients
to a dentist.
Yes.
Yeah, that's the
Yes.
only
That's my learning point too. Yeah.
Generally for
Yes.
everyone. Just
So
keep that
கேக்குற audience வந்து go to the dentist. கேக்குற obstetrician and gynecologist
Refer to a
dentist refer பண்ணுங்க. ஓகேவா? Okay, right. Thank you. Thank you so much, Jibran. Thank you.